In today's video blog, we're talking about the techniques we use during a rhinoplasty to narrow the nose. It's a very common concern with patients when they come in and they say that their nose appears too wide on their face. And so we have to talk about there are different ways that we can make the nose smaller and less wide. The nose is composed of bone and cartilage. The top part of the nose is the bony part, and the lower part of the nose is composed of cartilage. And depending on the anatomy, we're going to narrow those in different ways. If we look at the bone area, the part that's up high, if the actual bones are spaced out wide, then the way that we narrow the nose, we actually have to bring the nose and bring the bones in closer together. The way we do that is by something called nasal osteotomies. That's called nasal fracturing, or breaking the bones to bring the bones closer together. If patients have a very flat nose from the side, then part of the reasons why their nose appears wide from the front is because their nose doesn't come out farther from their face. And for those patients, we have to augment their nose or bring the nose out farther from the face at the top bony part to create a nose that appears more narrow. The same is true for the cartilage part of the nose. If the cartilage part of the nose is wide down here and their nose is not projected, then we have to bring the nose out farther from the face to make it appear more narrow and more defined from the front. It's very common for ethnic noses, or especially African American noses, for that technique. Additionally, the tip of the nose could be wide or bulbous, and there are a variety of techniques we use by removing cartilage, putting cartilage in better positioning, re-supporting it, and using sutures to create a tip that is less wide. And finally, the third area where people complain or have concerns about a wide nose is the nostrils. Sometimes the nostrils are too far out. And what we're looking at is you want the nostrils to be kind of at the inner corners of the eyes, and that's the width that we're looking for the nostrils. If they're too wide, then we'll do something called alar base reduction. And that technique, what we do is we make an incisions in the little crease of the nostril right in this area, and we just have to remove a little bit of skin around the nostrils to narrow the nose in the bottom part. So in today's video blog, we talked about narrowing the nose in 3 different areas. One is in the bony, or the upper part of the nose. The second part is in the cartilage part of the nose in this area. And the third part is narrowing the nostrils. Thank you for your time.